thank you for spending a little bit of time with me today. It's Friday. Where are you located in the country?
Can you hear me clearly?
I can hear you.
Okay, so I stay in New York.
You're in New York?
Yes, stay in New
Okay.
York.
Okay, cool, cool. And are you a PCNSL patient?
Yes, I am.
You
Yes.
you are the patient. Okay. When were you diagnosed and how?
So I was diagnosed a few years back. I can't really get the number right now. I'll have to like get some documentation right.
Mm-hmm.
But yes, some years back, and it was I had to go through some tests, some basic tests, and I was diagnosed. So I've been basically for more than 3 years now, basically. So it's kind of like something I've been through for a while now. So yeah.
And how do you feel? How are you feeling?
How I'm feeling now? Okay, now I would say I'm just trying to live life, enjoy life,
Good,
do the
good,
best.
good. Well, you look good. You look super
Thank you.
healthy. You got a great smile. So, thank you for spending a little time with me today and agreeing to allow us to videotape our short interview today. I have two questions for you. The first one is, since you are a PCNSL patient, what is it you wish people knew about this disease? And it can be one or two or three things, right? It doesn't have to be one single thing. It's up to you how you want to respond to that. But what is it you wish the public, people, knew about PCNSL?
Okay, so first of all, I would say it's one of the rarest, should I say, really rare conditions. So it could be should I say lonely in terms of having to be part of the people that go through this type of situation.
Okay.
So, you know, honestly, the minority that have this just really want to let them know that they're not alone. Basically, not alone
Okay.
in this.
You,
I feel it's something that
Jerry, you're having internet problems today, aren't you?
at this
Hi.
point I'm so frustrated at this point. I'm so sorry. I'm
Don't
so
worry, it's
frustrated.
okay. It's okay. So I heard you say that you wish people knew about PCNSL,
Yes,
that it is a very rare disease. And
yes,
because it is a rare disease, it sometimes can be lonely. Did I hear you say that? It
yes.
sometimes can be lonely on your patient journey with PCNSL.
Yes, and I feel the fact that it's something that people notice outside. When you're trying to speak, you're having like issues speaking and trying to communicate with people. I feel it could also be overwhelming. In terms of like the defaults and the defects that comes along with speech and the disorder itself.
Good. Let's go back to what you were talking about. I said you can also it can feel overwhelming, but you were talking about something about speech, right? Can you talk about that some more?
Okay. So what I think is, I think it can be overwhelming outside when you're trying to communicate with people, and you're having like speech problems. So and it's something I feel it's very noticeable outside and people that you don't know, like people you're trying to communicate with, and you really don't like the should I say the strangers. So it's something that I would say. Okay, sorry. It's something that I would say it's a problem. And for me as well, I feel it's a problem for me. And also generally, I think people that are going through this as well, I feel they also have this problem. The speech generally having problem with speech. Right now, exactly, I'm doing my very best to like give you the best of my speech.
You're
So
speaking great. I just was couldn't hear you. I apologize.
no problem.
So one of the symptoms then of PCNSL is difficulty with speech.
Yes,
And you wish people knew that.
Yes.
Can you say that for me?
Okay, so basically one of the basic main symptoms of the disorder is the fact that it affects your speech over time and trying to communicate with people.
Okay, that's well said. Thank you so very, very much. So you wish people knew that so that, of course, they would understand and frankly
Yes,
probably have more patience when
yes,
communicating with you and you communicating with them, correct?
yes.
That's good to know. That's really, really good to know. Thank you. Thank you for sharing that. That's a very good thing that maybe my organization can work on helping people become more aware of that part of that specific symptom.
Yeah.
And so that does that happen over time or does that happen right away? Or what happened with you and your speech?
Okay, so when I was diagnosed with it, I really didn't know that it was gonna affect my speech. I wasn't aware of the fact that I mumbled, should I say, mumbled sometimes when I'm communicating. But over time, I realized people were like asking me what I said, like, "What did you say? What did you say?" So I felt a little overwhelmed that people ask me back. The should I say the need to repeat myself kind of brought the awareness that people aren't really they're not really understanding me sometimes. People don't really get my verbal information at first when I first speak. So I think that was when I like got awareness that it could be a problem for me and people going through it as well. People going through this disorder as well.
Thank you so much. Thank you. Well, well, well said. Thank you for sharing that. That's very important for everyone to understand. So, my second question is if you were talking to the pharma industry, and so pharma industry is a big word, but what I'm really talking about is the companies that are researching this particular disease and hopefully are coming up with a better treatment option that will evolve into standard of care someday, right? For PCNSL patients. What do you wish you could say to them?
Okay, so if I was communicating with them right now, okay, I would say stress is something that prompts for more speech. Should I say murmuring? I feel over time, stress is something that could help. I mean, sorry, could worsen the situation. I mean, if it's in terms of trying to help people, they should look for something that could ease stress. I mean, in terms of like drugs that could probably like cause relaxation and like try to ease the stress, and maybe even work on like a stress toy or something. Maybe try to get a stress. Should I say stress toys? I know I have some in my closet. I use it in terms of trying to calm my nerves down. I just use a stress toy to get myself in a situation I can reduce my anxiety over time. I feel anxiety too could also as well add to stress.
Agree with you. Um, I want to dive into that a little bit if we could. I think I'm hearing you, and I don't want to put words in your mouth, but I want to make sure I understand. It sounds like you're saying when people are diagnosed with PCNSL, it might be important for people to also be prescribed maybe something for their stress that because this disease is going to cause stress, is what you're
Yes,
saying. And stress, of
yes.
course, causes more stress. It also causes more
No
anxiety.
stress.
It
Yes.
causes, in your case, I think I'm hearing you, stress also causes deficits with your speech.
My speech.
Okay. All right.
So it's kind of like when I feel stressed, the like sometimes like when I go for like a walk or I could go like jogging, probably like go for a walk or like a sporting activity. When I get back, I find it really hard to communicate with people in my house. I really just would like to like take a bath, like probably take a bath and like rest before like communicating. Because over time, I realized like when I'm stressed, I really don't even want to communicate with anybody because I know it's probably gonna be really hard to communicate. So I just stay to myself when I'm stressed.
Besides the mumbling, Jerry, how else is your speech affected?
So for me, it's kind of like a situation where I try to arrange the words in my head, but they get like they are, should I say, mumbled, scattered a little should I say, I don't know how to put it in words, but it's like I just can't fit the words together, so they come out like really scattered.
Okay.
Yeah, I think that's the
Um,
best description.
yeah, so your speech pattern, the words are scattered instead of like right now we're talking, you're completely talking to me fine. I completely
Yes,
hear you. I completely understand what you're saying. You're putting your words in the right order. It makes total sense to me.
yes,
But if you're stressed, you're saying that besides mumbling, your brain is kind of scattering your words, right?
yes,
So it makes it really hard
yes,
to communicate.
yes.
Oh, wow. Okay. So let's go back and I'm going to ask you, I'm going to be quiet after I ask you this question. It's the same question I asked you before. And I want you to literally speak to the camera and tell the pharma industry what you wish they knew about this disease and perhaps what they could do more. If they could do more, what could they do for people who are diagnosed with this disease?
What they could do to help people that are going through this disease is in terms of helping with a should I say a drug or or like a prescription that could help in easing stress, that could help to relieve stress. I feel that could help for people that find it hard to communicate and have speech. Should I say? Uh, should I say speech? Restrictions. Yes, I guess that's the word. Speech restrictions to try to work in a drug that could help to ease stress.
Thank you. When you were diagnosed with PCNSL, I don't know the answer to this, so I'm just asking. You made me think about something. When you were diagnosed with PCNSL, were you also, what's the right word, provided a speech therapist or speech, rehab or anything like that?
Okay, so the first year of being diagnosed, I wasn't actually that I wasn't given like a speech therapist. So it was later on when it was noticed by my parents. Then we went back to the hospital and we were told to go to a speech therapist to try to, you know, seek help. So that was what we did the second year of being diagnosed. So at the
Okay.
first year, I don't think it was this bad in terms of like how it is now in terms of like the speech problems. But later on, when it became so, should I say, so visible, people could really tell that there's something wrong with my speech. So I had to get it out, get it checked out. So that was when I got the speech therapist. So I think it's very important for people that are just being diagnosed to like get speech therapy like the first year. If I really had the chance to get it the first year, I would. I think it's gonna help to prepare your mind for something like that in a situation where it later gets worse. I think it's something I wish somebody that's just realizing this disease could just do in terms of getting the therapy right away, preparing your mind for whatever is going to happen in the next 2 years, 3 years of having the disease. So yeah.
That makes sense. Thank you. A question for you. When you were first diagnosed with PCNSL, did your healthcare provider talk to you about symptoms or give you a sheet or something on symptoms, potential symptoms of this particular disease?
Yes, yes. The first year of being diagnosed, I was given like a slip. It was kind of like a slip,
What's that?
like should I say a paper? I don't know how to say, but like a paper. It
Uh-huh.
was kind of like an informative paper, like a paper that I could read. It was basically about the disease. So
Did they
it was
print
given
it
to my
out while you were there and then give it to you when you were
Yeah,
leaving? Yeah.
it was printed out. Yes, it was handed over to my mom, and yeah, she gave me a home. So I went through it. I was told to also go through it as well. So I went through it in the paper, and I saw the symptoms, what I should expect, and I also read stories about people in the paper as well. People that are already, should I say, already have the disease and are striving, getting better over time with the drugs that are being prescribed and everything. So it was kind of like a paper. I don't even know where the paper is anymore. It's been years now, but I know I was given a paper that day. I think the week I was diagnosed.
Okay. Okay. Well, then that's a good thing. That's a really good thing,
Yes,
right? So
yes,
they
yes.
just kind of handed it to you, and that was pretty much it. No discussion, no opportunity for you to ask questions or anything like that.
Uh, I think the main discussion was done with the doctor and my mom. So I
Oh,
think yes, that was
okay.
the main, yes. So I think all I was just a patient, and I just knew very little about what was going on. It was later on, my mom started telling me, okay, this is what is wrong with you, and you will have to take this, you have to see a therapy, you have to do all of that. So
Okay.
I did have some conversations with the doctor, but I feel the main conversations were with my mom, the
And
doctor and my mom.
your mom is your care partner. Your care,
Yes.
yes. How old were you when you were diagnosed with PCNSL?
I would have to do some maths. I think like we were 2025 6 years ago or five.
Oh,
I gotta check
okay.
the time, the date
Okay.
exactly. Five,
And how old are you
yes.
now?
I'm telling you, I'm 21 right now.
You're
20
what?
actually.
You're how old?
I'm 20, I'm 20, gonna be 21 this year.
Okay, so you were maybe like 15 or 14 when you were diagnosed with PCNSL, correct? All right.
Yes.
Yes. So you have been living with this disease for a while.
Yes, actually.
Yes. Jerry, if there is there anything else you'd like to share before we go? It's up to you.
Okay, so I just want to say that people that are going through this disease, okay, uh it could be overwhelming at first, it could be really overwhelming at first. I remember the week I was diagnosed, went I out of curiosity I went like I went to do my research. As a kid I felt like, okay, I got to know what's wrong with me. So I went to do some research, and I saw like the symptoms and what could happen over time when I grow up, and I was scared. I wouldn't lie, I was literally scared about what was going to happen. I felt the need to know about it, but I was also scared. And I remember clearly the week I was told, I cried. I had some tear in my eye, and I was playing video game. My mom saw me crying. She was like, "What's wrong? What's wrong, Jerry?" And I was just like, "Is everything okay with me? Am I okay? Am I good?" Because I was seeing the doctor like every week, and it was kind of like getting scary. I was like, "Am I okay?"
And yeah, and so that was what you were thinking about is am I okay or am I going to be okay? Right? And that is very scary.
And she said, "I'm okay."
Your mom said
Can
you're
you hear
okay.
me?
Well, that's good.
Can you hear
Jerry,
me?
yes, I can see you and hear you. Yes.
Okay. So
So,
she said, okay. She said I was gonna be okay. I remember clearly. She said I was gonna be okay, and I'm okay. So I think it was something I held into. I like
uh-huh.
held. Yeah, I was like, okay, whatever happens, it's gonna be okay. So, I just want to say people
Uh-oh.
that are the
Hey, Jerry, there you are.
hello.
There you are.
Yes. So I want to say people that are in the early stage of this illness, I feel they need to have like some sense of comfort, and they need somebody to try to make them feel better about themselves and make them feel they're not alone, and they're not they're should I say they're not different from everybody. They're just they're the same. They're all the same, and they're gonna be fine. So that's just it. I know people that are probably gonna be like seeing this at the age I saw it. That's like early, it's going to be overwhelming and it's going to be a shock and it's going to be, so, but having somebody beside you could help,
Mm-hmm.
so that's just it. That's just what I have to say.
You're very lucky that you have your mom.
Yeah.
Sounds like she's been taking great care of you. And I think what you're also saying is it's helpful to have someone walking this journey with you, right?
Yes. Yes.
Were you were you put into contact with any other people that patients who have PCNSL?
At first, I think the second year of this, I actually was I got to know a few people that were going through this as well, but most of them were kind of older than me. You know, I there was like a community group for people like that as well. I remember having like a messenger group. It was basically for people with this
Oh,
illness, but they were all basically older than me. I like 25, 23, 22, 21. And I was like, no, I don't think I want to like, just,
yeah, so you might be saying, without saying it, that it would be helpful to have because you were younger when you were diagnosed. You were 14
yes,
or 15.
yes,
Um, um, it would have been helpful to you to have a group of your peers, you know,
yes,
people diagnosed with this
yes.
disease around the same age as you to be connected to them. Is that what we were saying? Can you say that?
Okay, okay, okay. So, I would love for people that are, just getting to be diagnosed of this disease, of this illness, to have like the opportunity to have people or people of the same age range and going through the same should I say disease, to have like communication with each other. And I feel like it's going to help. So it's going to help because you want to be able to communicate with people that you are more should I say able to interact with in terms of age range. So I think that is going to help because it wasn't really on my side. I wouldn't say I had people that were of my age range. So I would love if people that are of the same age range could like meet up together and have discussions about it, and yeah. So I think the age range is really important to me in terms of people. So
Okay, that
yes,
makes total sense to me. Thank you. Thank you so much, Jerry. That makes a lot of sense to me. So thank you for sharing that. Okay, our time is up and we've had a really good discussion. So thank you so much.
yes,
You've enlightened me a lot, which means you're going to be able to enlighten other people, other patients, but with PCNSL, but other care partners of PCNSL patients. And remember, I was talking about the pharma industry, all those folks.
yes.
You're going to be what you shared today will help them understand this disease much, much better from your perspective, you as a patient. And that's how we get to make positive change in patients' lives together. So really, I sincerely thank you for spending your time today sharing what you
No
shared.
problem.
So
Yes,
thank you.
I'm so glad to be able to share as well. Okay, thank you
Thank
so
you so
much.
much. Have a great Friday. All right. Bye-bye.